Welcome back. We continue with our health focus today. We are talking aesthetics, we're talking surgical and non-surgical procedures that people might be opting for to be a better version of themselves, or sometimes for the wrong reasons as well, if you're doing it for someone else or you're just not happy with yourself on a very deep level. Well, Dr. Anushka Reddy from the Cosmetic Congress of South Africa joining us now to talk about non-invasive surgery. Dr. Reddy, good morning and thanks so much for your time. I know that you are a very, very busy doctor, so thanks so much for your time this morning. I want to start first with looking at what we've just come through, or what we're going through at the moment in terms of COVID-19, and if that has affected what you do, your work, the aesthetics landscape at all.
So, thank you, Uveka. Lovely to be back on the show. What I want to say about COVID and its impact on the aesthetic industry, it's been a very interesting ride, of course. I was very concerned that patients would be concerned about losing their jobs, loss of income, and aesthetic procedures would be on the back burner. But surprisingly, it's not been like that, especially with women. It's so important for people now more than ever to look good because they feel good. So there are still lots of people who are working, who are earning money, not traveling, not going out, and they want to now invest this money in themselves. So if anything, COVID has had a very positive impact on the aesthetic industry.
Like we say, there's always a silver lining, Doc. So let's talk about non-invasive. We've chatted to Dr. Ridwan Mia about invasive and going under the knife. Non-invasive, which is a lot of what you deal with. What do we mean when we talk about non-invasive? What are these procedures?
So non-invasive basically means non-surgical. It means when the body is not cut in any manner or altered in any permanent fashion. So specifically we refer to Botox and fillers. That's very much the cornerstone of non-surgical treatments. And with these type of procedures, they often have a duration. So in the case of Botox, lasts 3 to 4 months. In the case of fillers, anything from 9 to 18 months. And then over that period of time, the products are slowly degraded by the body. And then it's up to the patient, do they like the effects of the Botox and fillers? And then they just visit their doctor to have the procedure repeated.
All right. Well, what are the most popular requests you get in terms of non-invasive procedures here in South Africa?
So at my practice specifically, I would say the bulk of my work depends on fillers. I get results immediately. So fillers are made of various different substances. The one that I use mainly in my practice is made of calcium. Now, the great thing about calcium is that it stimulates collagen. So we're getting much longer lasting results than your normal, what we call hyaluronic acid fillers. And not surprisingly, I must tell you, the area that I have the most requests for is under the eyes. Because we're all wearing these masks, so the focus is very much the eyes. So I'm getting lots of patients coming through, asking to have their dark under eye circles. So last year it was lips. Lips was very much in vogue, and this year it's the under eye treatment.
Okay, so I suppose the eyes and the foreheads as well are the big ones post-COVID, I'm sure, Doc. So this type of procedure, is that meant for people who sort of want to have that little change, want to look that little smoother, but they don't want everyone to know that they've had something done? Or can you tell these days that somebody's even had some of this work done?
The best part about this is if you go to the right injector, have the correct procedure done with the right quantity of products, nobody should be able to tell that you've had anything done. You should leave people guessing. Have you been on a holiday? Have you had your hair just done? Have you changed your skincare range? People must not ever be able to put their finger on what you've had done, because that, in my opinion, is just a job that has been poorly done.
Okay, so even if your husband or wife doesn't know, that's even better, because they see you every day, and if they wonder, honey, why are you looking so good? Okay.
You know what? I must tell you, Rebecca, in terms of husbands especially, when they say to their wives, what have you done, and something doesn't look right about your face, that's when I worry, because that's when I know that something, is skew or something needs to be fixed on a person's face. When the husband doesn't complain or doesn't comment, then I know that's the job that's perfectly done.
Okay, well, that's wonderful. Well, that brings me to the next point is we often think this is a world where mostly women dabble. Are you seeing a lot of men who come in for these types of procedures?
Yeah, absolutely. So in the last, I would say, 5 to 8 years, my practice has shifted from being, I would say 90% female to now being 60% female and 40% male. So a lot of males coming through, especially men are working much, way past so-called retirement age. And they're up against these young bulls, in the boardroom. So So they want to look the part. So we're having men coming through for these procedures because they also want it done in the shortest possible period. So lunchtime procedures for them, which allows them to come in, have a few jabs, and off they go, to do their business. So I'm very much seeing a great increase in the number of men coming through.
Lots of misconceptions, though, Doc, around this type of thing. I'm not sure if we've managed to sort of smooth those out, pardon the pun, over the years, but a lot of people feeling if I do something like Botox or I do fillers, I'm putting poison into my body, I won't be able to move my face if I'm going to look like Nicole Kidman. We often criticize her for not having any expression in her movies or whatever it is. Just dispel some of those for us, or how much of that is true?
So, that's just all stuff that you're reading, these tabloids. Tabloids, this is like fodder for the public. So they love selling all these myths and misconceptions. The truth is, Botox is a scheduled medication. So it's only administered by doctors. And it does not have a permanent side effect or should I say, long-lasting results. It only lasts for 3 to 4 months. It's certainly not rat poison. It's perfectly safe to use, has been used in medicine for over 6 decades, and has been used in aesthetic medicine for the last 3 decades. So we have excellent safety profiles on something like Botox. And fillers, obviously, it's made of hyaluronic acid, which is the natural component of the body. And that's broken down over time. So these things are perfectly safe to use.
When would you say no to a patient, Doc? Is there an age limit to what you do? If somebody's too young or too old, what's too young or too old? Who can come to you? And when would you refuse and say, I can't do this on you?
So I usually look at the maturity of a patient. So, for example, in a younger patient, a patient under 25 years old, those type of patients are coming to me more for preventative measures, like Botox, for example, between the eyebrows. I don't have a problem in, administering Botox in those patients. Patients younger than 18 years old, if they want to have any aesthetic procedure, I certainly do not advocate or recommend it. So for me, I would use 18 as a cutoff. And that simply is more based on maturity. And also, at 18, you're still developing. So we don't want to interfere too much with that process. In older patients, there is actually no limit. My oldest patient at my practice is 85 years old, and she feels like a 60-year-old when she looks at herself in the mirror. So, that's the great thing about these procedures.
And when it comes to those older patients, do you also have to consider other illnesses, whether it's things like blood pressure, diabetes, all of that? Is that a concern with non-invasive? We know it is with actually going under the knife. There are concerns.
Actually not. So that's the fantastic thing about non-surgical procedures. There is no real concern about any underlying chronic medical conditions. Obviously, there will be certain cautions taken if patients are on blood thinners, for example. Certain vitamins like vitamin C, we know that it thins the blood and will cause a bit of bruising. So yes, we are. Those are what we call, relative contraindications. They're not absolute. So in terms of non-surgical procedures, you can basically do it on anyone.
We also have to, there are people who might just want to try this once just to see what it looks like. Maybe, and in terms of affordability, like you say, some things last 3 to 6 months, some last 18 months. So if somebody just wants to try this once, and once it wears off, is that doable? Or if you are not planning to continue, you shouldn't start this at all. Does your face sort of sag even more than it did before if you can't afford to go back once this has worn off?
I get that question all the time, and trust me, nothing happens to the face. So once you let the Botox or the filler wear off, your face just reverts to what it was pre-injection. There is absolutely no sagging, and there is no signs or evidence to support that the skin is affected in an adverse manner if you ever stop these procedures.
And you speak of something called Zoom face. What is that, and what are people asking you for?
So I must tell you, in the last few months, like I said, with COVID, it's affected people's work. So people don't go to the office anymore. So they're sitting at home, they're still working, but they're behind the screen. And when you, especially with a Zoom call, right, the camera is on your face, the light is on your face. And this is when people are actually noticing the little bits and bobs on their face that they're not entirely happy with. So I'm getting lots of people coming in and saying to me, when I was in a Zoom call, I noticed that my under eyes looked particularly dark, or I noticed that my lips were very thin. I noticed a shadow, my mid-face was beginning to sag. So I'm getting those type of patients coming through, whereas a few years ago it was about, oh, my husband's complaining that I'm looking a little bit older. So So it's very much changing. And we need to be careful now because I'm watching this to see if this develops into what we're calling Zoom dysmorphia, which is, an offshoot of body dysmorphic disorder, where people are just not happy with themselves. So I'm waiting to see if this does evolve into one of those other conditions.
And Doc, if I can ask you in just a very few seconds, how would you know where's a good place to do this? Because it seems every beauty salon is offering you some kind of procedure or Botox or fillers or collagen. Just a word of caution to anybody who might be looking for a good place to go.
For me, it's just common sense. You wouldn't go to your hairdresser to have your tooth removed. So you should not be going to anyone except a medical practitioner in a medical environment who has a minimum of 5 years experience, administering these procedures. We're seeing lots of complications coming through. So be very cautious of who you go to. And it must be a doctor who's registered with the HPCSA.
All right, thanks very much, Dr. Anushka Reddy. And I can just say your Zoom face, absolutely beautiful. Thank you very much for that sound advice. Coming up, being a better version of yourself is actually okay. There's nothing wrong with it. Some people do yoga, some people turn to science. Next, I'll be talking to a woman who has had a procedure done. We'll talk about her experience.